This is the dental assisting lab area. The objective of the dental assisting program is to provide quality career education that prepares students not only for seeking entry-level employment in the dental assisting field, but also for lifelong learning and personal and professional growth. Dental assistants perform a variety of patient care, office, and laboratory duties. They sterilize and disinfect instruments and equipment. They prepare and lay out the instruments and materials required to treat each patient and obtain and update patients' dental records. Assistants make patients comfortable in the dental chair and prepare them for treatment. During dental procedures, assistants work alongside the dentist to provide assistance. I'm going to introduce you to our program director, Cheryl Evans, who will show you around the lab.
Hi, I am Cheryl Evans, and I am the program director for dental assisting here at Fortis College, Richmond. Right now we're standing in the sterilization area. This is where we have an operating sterilization area. We have an ultrasonic that our students learn on, and we have our Statum as well as our autoclave over here. And we are able to maintain those and make sure they are being maintained by our in-office biological monitoring system, and we also have one that we mail out as well. In here we have kits that we keep for sterilized processes where we would use to work on patients or each other. We would use our sterilized kits. In these drawers in front of me, we have all of our instruments that are available to our students. Those are oral surgery, we have restorative, we have all different types of instruments that are available for our students to be able to utilize and see how they are kept in a dental office. Coming down further, we have our burrs and our handpieces that are up here, so our students learn how to utilize those as well. Then in this cabinet here, we have our emergency kit and our first aid kit, and then we also have our teaching materials up here for emergencies as well. Here we have our binders that we keep for accreditation purposes, and we have our working AED and our oxygen in case, to be able to help them understand how to utilize this. Going into the clinic, we have our 5 chairs that students are assigned, and they're assigned each chair. And we have the assistant carts that are in front of these chairs that are fully stocked, where our students will be able to utilize those as well. And they are responsible for their own chairs. Coming forward, in the cabinets above, we have, for different procedures, we have all of our materials that are in here. We have matrix bands, amalgam, composite, everything that we would utilize when we just normally do a procedure. In this one, we have periodontics, oral surgery, and crown and bridge or impression material. In this one, we have orthodontics up here at the top. Endodontics and rubber dam is currently in a classroom being utilized. And then we have our cement spaces and liners here. Then over here, we have our preventative. So we have our sealant material, prophy angles, disclosing tablets, and fluoride trays. When the students are not working on each other, we have kits where they work on their dexters, and we have 5 dexter heads. And we also have the kits. This is a restorative kit that we have. Each one is assigned to a chair. So we have our restorative kits in here that each student will use at their chairs. We have endo kits are in here. And then we have crown and bridge, basic kits, and then prophy kits. In here we have our oral surgery. This goes along with the oral surgery up here, where we have blades and suture material. And then here in these 2 drawers is our anesthesia setup. So the students will learn how to do that. Then we can go into the lab. And when we're in the lab, this is where the students are going to be doing some of their lab components and competencies of the program. So if they were to take impressions on each other and on Dexter, we have our impression trays right here. We also have a whippet so they can mix the alginate this way, but we do have mixing bowls, alginate, their cups, and their spatulas to be able to mix that. And then we have our model trimmers. We have 4 model trimmers that are set up, so when they go ahead and do their trimming, they have that. Down here, we have the vibrators. They're kept down here. So we have several vibrators that are kept down here for our students to be able to utilize. And we have our stone. And then up here is where the students keep their kits, where they are assigned their typodonts, their protective wear, their PPEs, and they keep their materials that they've worked on and their items that they've created, like provisionals and things. Over here we have the Pentamix to be able to teach them how to load that and use that. We have a microabrasion handpiece right here. We have the lathe over here. We have the other 2 model trimmers. And then here we have the vacuum formers so they can fabricate their whitening trays. Okay, so in our radiology room, we have 3 chairs that are here on the other side of this wall, and then on the other side of that wall we have 3 chairs where our students can take radiographs. Here is our dental unit, or not our dental unit, our radiograph unit right here that we have set up in here. And there's another one on the other side on the wall over there. We have the ability to show to do traditional radiographs, but we also teach them radiology, sensors, my apologies. So they do have the ability to do digital as well as traditional. And then, as I was saying, we have our 3 chairs over here. And then we also have a Panorex machine where we show them how to take Panorexes as well as, position the patient and get them ready. And our certificates are hanging on the wall.